So now we are in our second topic, which we will introduce more on our software. It calls Veriosteo OB. So as you can see, there are two systems here. On the left one, we call it the DEXA scan, and on the right one, we call it a quantitative ultrasound, which we call it QUS. So the bone mineral density test actually face challenge with DEXA being the gold standard, but not portable. While QUS offers portability but lacks of accuracy, highlighting the need for convenient and precise tool. So currently, Veriosteo will be an ideal bone density screening tool because Veriosteo offer a more precise screening for abnormal bone density compared to QUS and DEXA. So as you can see, it's more convenient and the accuracy is much more highly accurate compared to QUS. So in today's our accuracy is up to 89 to 90%. Veriosteo is approved by Taiwan FDA. It uses AI to analyze chest X-ray, predict bone mineral density, calculate T-score, and provide recommendations, offering a breakthrough in the bone mineral density screening. And today, Singapore, Thailand, Indonesia really got the cert as well. So it's been starting to be using across in Asia. And we also have a paper publication which we will share in the link later. And this is a medical device authority cert approved by KKM Malaysia. So Veriosteo workflow is very simple and straightforward. You just need an X-ray machine and you do a PA view chest X-ray on your patient, which is a posterior anterior view, and you send the image to your CR or DR workstation. As long as it's a DICOM image, then you can import to our software. So from our software, you just need to fill in some details like the patient name and the operator, and you just click analyze. So from there, about 2 to 3 seconds, you can get a PDF report as this example. So after your report been analyzed, it will give you two files. One is the Excel file and one is the PDF report file. So what we are practicing now is we need to advise our user to look into Excel file first, just to make sure that on your left the status are all success, then only you can provide the PDF report to your patient. This is because sometimes that the image that we import, maybe the resolution is not that good, or the image might be blur, or the AI can't recognize and it will not give you a test result. So it will comes out to a failure. So as long as your image are good and normal chest X-ray view, normally our software can be analyzed successfully. So this is the sample report, which is suspected abnormal and no significant abnormality found. So which means that like one is like normal, one is like suspected abnormal report. So if you can see that the suspected abnormal report below at the T-score, anything below negative 2.5 is suspected osteoporosis, and anything above minus 2.5 we will be considered in yellow, low bone density, or in green as a normal patient. This is a sample DEXA report. It helps us explain why patient flag as risk by Veriosteo, especially those with a T-score below negative 2.5 should be referred for a full DEXA scan. While Veriosteo is a useful screening tool, DEXA scans the whole body and give a more comprehensive gold standard diagnosis for osteoporosis. So this is a quick view on how does Veriosteo work. It actually analyzes your existing chest X-ray, focusing on the spine area, specifically between T12 and L1, to estimate your bone mineral density. Based on that, it categorizes your risk as normal, low bone density, or osteoporosis. So it's a fast, and the result are ready within 5 seconds, and an auto-generated AI report is provided. This makes it ideal for GP clinics, especially during routine checkup or health screening. Best of all is non-invasive, allow mass screening and help detect risk before fracture occurs. So, which is key in preventing serious complication related to osteoporosis. So, Veriosteo acts as a smart and practical first step before we decide whether a full DEXA scan is needed. Now let's look at the indication for using Veriosteo. This tool is especially useful for patients at risk for osteoporosis. Postmenopausal women who have a higher risk due to declining estrogen levels, elderly patients as bone density naturally decrease with age, and patients with a history of fracture or those already found to have a low bone mineral density. In addition, we can also guide patients to do a quick 1-minute osteoporosis risk test provided by the International Osteoporosis Foundation. It's simple and a great starting point for awareness. You can find it in the link shown here. So there's another tool, we call it OSTA. It's actually created for Asians. It's called Osteoporosis Self-Assessment Tool for Asian. So it's a simple tool that helps estimate a woman's risk of osteoporosis using just age and weight. So the formula is weight in kg, age in years times 0.2. So based on the score, risk is categorized into low risk, which is more than -1, moderate risk between -1 and 4, high risk if less than -4. So as shown in the chart, older age and lower weight increase risk. So for example, a 60-year-old woman weighing at 50 kg falls in the moderate risk zone. So understand your risk, help determine if further testing or early lifestyle are needed. This slide covers how we explain the results to patient and what action recommend to take. If the bone density is normal, we reassure the patient. If there's a moderate risk, we recommend further testing like a DEXA scan. If the risk is high, early intervention is important to prevent fractures. So, recommendation include eating a calcium-rich diet, doing weight-bearing exercise regularly, okay, considering medication or a referral to a specialist is needed, and finally scheduling a follow-up screening in 1 or 2 years time to monitor progress. And this slide highlights important clinical consideration when using AI screening. AI is a tool, not a replacement for clinical judgment. It helps flag potential issue but shouldn't be used as a standalone diagnosis. Always consider the patient history and overall clinical picture. And finally, any abnormal findings should be confirmed with a DEXA scan or by referring to a specialist before making treatment decision. When using the AI system, Veriosteo, you might encounter some common issues such as poor image quality or inconclusive results. In such cases, do reach out to technical support for help. We are available to assist you quickly. Let's go over some important notes and warning when using Veriosteo OP. Firstly, the software only analyzes PA view chest X-ray images, so it doesn't support lateral view or other regions. Also, ensure the image resolution is at least 1024 by 1024 pixel to meet the minimum requirement. So now regarding the patient positioning, the patient must be in an upright position. Adjust the IR height to match the chest. Center the mid-sagittal plane. Ask the patient to stand straight, arms at their side, and bend the elbows slightly. Lift the chin upwards and rotate the shoulders forward for a better spine visibility. For the central X-ray, align it perpendicular to the center of the IR, level with T7, which is the inferior angle of the scapula in terms of collimation. Use 14 by 17 inch, which is 35 times 43 cm, and try to crop out any excess white area during post-processing for better analysis. The SID should be 180 cm with a tube voltage of 70 to 124 kVp and an exposure time between 2 to 15 MAS. Finally, make sure the patient perform full inspiration. The X-ray should be taken after the second full breath in to ensure proper lung inflation and clearer spine visibility. Following this step will help ensure the image quality is optimal for accurate AI analysis. This slide explains how Veriosteo handles spinal landmark detection in chest X-ray. If the image doesn't meet the requirement quality or visibility, particularly of T12 or L1, the analysis may be affected. However, the system is designed to automatically adjust. If T12 or L1 isn't detected, it will shift the analysis upward using vertebral like T11 or T10 instead to still generate reliable bone mineral density and the T-score result. Veriosteo is equipped with automated spine landmark detection, which allow it to identify the spine from T1 downward, ensuring accurate coverage and analysis even when some parts are unclear. This built-in adaptability ensures consistent result despite some variations in image quality. To wrap up, here are some key best practices. First, always ensure the patient is properly positioned. This is critical for accurate analysis. Next, take time to review the AI generated report carefully, understanding its finding and limitation. It's also important to communicate result with empathy, especially if the patient is at risk. And finally, always follow up appropriately, whether it's further testing, a referral, or lifestyle guidance. Thank you for your attention. Let's work together to deliver better care through accurate screening and informed communication.